Let us start. My name is Dr. Wajid Khan. So guys, we'll start with this topic of glaucoma. Glaucoma. You might have heard about this glaucoma many times guys. Yes or no? It is in ophthalm, it is the most important topic. Apart from cataract, this disease of the eye is also a very important thing. Glaucoma. So we are talking about this thing called as glaucoma. What is meant by glaucoma, guys? What is meant by glaucoma? Glaucoma. Glaucoma means what? What comes to your mind, guys, when we are talking about glaucoma? I hope raised intraocular pressure comes to your mind. But raised intraocular pressure, it itself is just not glaucoma. Okay? Glaucoma means what? Raised intraocular pressure which causes damage to the optic nerve, or which causes damage to the optic disc, not nerve, which causes damage to the optic disc, and due to the damage, the patient will have visual field defects. Visual field defects, that is called as glaucoma. Glaucoma means raised intraocular pressure with optic disc damage that leads to visual field defects is called as glaucoma. From these three, at least two should be there, then only glaucoma is said. Raised intraocular pressure with optic disc damage with visual field defect is called as glaucoma. Any two of the above three should be there, then only it is called as what, guys? It is called as glaucoma. Imagine a person is there who's having, first of all, what's the normal intraocular pressure, guys? The normal intraocular pressure is between 10 to 21 mm of Hg. Imagine a patient is there who's coming with an intraocular pressure of 30 mm of Hg. But he is not having optic disc damage. He is not having visual field defects. No visual field defects, no optic disc damage, only raised intraocular pressure. Is it a case of glaucoma? No. Glaucoma means what? Any two should be present between these three. Then it is a case of glaucoma. Then what is this case of? This is a case of intraocular hypertension. This is a case of intraocular hypertension. Intraocular hypertension, right? So remember, for glaucoma to be defined, any two should be present between these three, then it is all called as glaucoma. Okay? So imagine a patient is coming with a raised intraocular pressure with optic disc damage, but it did not develop visual field defects. Yes, it is a case of glaucoma. Yes, it is a case of glaucoma. Imagine, guys, a patient coming with an intraocular pressure of 22 mm of Hg, but he is having optic disc damage. He is having optic disc damage. He is having visual field defects. Is it a case of glaucoma? Yes, sir. Why? Because two things are present. So any two things are present, then it is a case of glaucoma. But such a glaucoma where intraocular pressure is low, it is called as low tension glaucoma. It is called as what, guys? Low tension glaucoma. Low tension glaucoma means what? The intraocular pressure is less, but still two other things are still present, then it is called as low tension glaucoma, which is commonly seen in whom? Commonly seen in Indians. We Indians will have this low tension glaucoma. Low tension glaucoma. Okay. So remember, guys, this was regarding glaucoma. Glaucoma is defined by these three things. Any two of the above three is called as glaucoma. Right. Glaucoma is a deadly irreversible disease which is characterized by, we have already discussed, raised intraocular pressure plus optic disc damage plus visual field defect. Visual field defect. It is called as glaucoma. This is called as what, guys? Glaucoma. Any two of the above three, it is called as glaucoma. At least two should be there from the above three. Then only it is said as what? Glaucoma. Right? If the patient is coming with a pressure of more than 40 mm of Hg, but no optic disc changes, no visual field defect, is it a case of glaucoma? No. It is just a case of intraocular hypertension. Intraocular hypertension. If a patient comes with an intraocular pressure of 15 mm Hg, but visual field defects are seen, optic disc damage is seen, then it is a case of low tension glaucoma. High tension meaning more than 22 mm of Hg. Okay, here I have written 22, no. Okay, imagine the patient is having intraocular pressure of 15. That is low tension, okay. Next, what is the basic pathology, guys? The basic pathology is a rise in the intraocular pressure that causes damage to the optic disc, causing visual field defects. Now, guys, glaucoma is divided into two types. One is called as primary glaucoma, other is called as secondary glaucoma. Primary meaning what? When the underlying cause is not known. Primary glaucoma means when the cause is unknown. When the cause is unknown, that is called as primary glaucoma. Secondary glaucoma meaning what? Glaucoma developing secondary due to any other problems of the eye. Any problems of the eye, that is called as secondary glaucoma. That is called as secondary glaucoma. Secondary glaucoma means what, guys? What any problems I am talking about? Glaucoma developing due to cataract, glaucoma developing due to uveitis. Okay? Glaucoma developing due to cataract problem, glaucoma developing due to cataract, or glaucoma developing secondary due to any tumor, it is called as secondary glaucoma. It is called as what, guys? It is called as secondary glaucoma. Just write there. Primary glaucoma means when the cause is unknown. Secondary glaucoma means glaucoma occurring secondary due to uveitis, secondary due to trauma, tumor, uveitis, trauma, tumor, or cataract. Then it is called as what, guys? Secondary glaucoma due to underlying disorder, secondary glaucoma, right? Now, based upon the presentation, glaucoma is divided. Based upon the presentation means, is it presenting at an early age or it is presenting at a late age? It is called as what, guys? It is called as child glaucoma or adult glaucoma. Child glaucoma or adult. Child glaucoma, there is divided into congenital and juvenile. Congenital means what? The patient developing glaucoma in what? From birth till 3 years of age, congenital glaucoma. Juvenile glaucoma means from 3 to 4 years. Glaucoma developing after 3 to 4 years of age. That is called as what glaucoma? It is called as juvenile glaucoma. So once again, guys, based upon the cause, primary and secondary. Based upon the age of presentation, that is called as what? Child and adult. Child is further divided into congenital and developmental. Adult is divided into open angle and close angle glaucoma. Okay? So congenital glaucoma is from birth till 3 years. Juvenile glaucoma is what, guys? The glaucoma which develops after 3 to 4 years of age. That is called as juvenile glaucoma. So anyways, guys, we are discussing about what? Congenital glaucoma. Congenital glaucoma. Congenital glaucoma means what? Come on, guys. Congenital glaucoma means what? Congenital यानी कि by birth the child is having glaucoma. What could be the cause of this congenital glaucoma, guys? Consanguineous marriage. Consanguineous marriage could be a cause of congenital glaucoma. Why? Because it's an autosomal recessive condition, and these kind of consanguineous marriages can usually cause autosomal recessive problems. Okay. Apart from that, maternal smoking is also a cause of congenital glaucoma. But guys, what will happen basically? What will happen if it is a consanguineous marriage, or if the mother is a smoker? What will happen? How will it lead to glaucoma? Imagine, guys, if the mother is a smoker and the child is being in the womb and she is smoking cigarettes for a long period of time, what will happen? That nicotine and the carbon dioxide goes to the baby, and what will happen, guys? In the eyes, it will basically hamper the formation of trabecular meshwork. You guys remember trabecular meshwork? Do you know what is the flow of aqueous humor? The aqueous humor is formed in the pars plicatum. From the pars plicatum, it enters the posterior chamber. From there, it enters the pupil into the anterior chamber. From anterior chamber, it goes into the angle. Beneath the angle, there is a mesh-like structure called as trabecular meshwork. The meshwork opens into Schlemm's canal that leads into the episcleral veins. That was the flow. Remember, due to smoking or autosomal recessive condition, what is happening? The trabecular meshwork is not being formed properly. If trabecular meshwork is not being formed properly, what will happen? Can the aqueous flow? Just look over here, guys. And imagine this is the structure called as angle. Beneath the angle is trabecular meshwork. Then beneath it is what? Schlemm's canal. And after Schlemm's canal, it is the episcleral veins. Okay. So the aqueous humor is basically flowing from the angle into the trabecular meshwork. If the trabecular meshwork is not formed properly due to maternal smoking or autosomal recessive condition, what will happen? Can the aqueous humor go inside? No. If the aqueous humor is not going and flowing, what will happen? The aqueous humor gets accumulated. What happens to the intraocular pressure? Increases. But how is the angle over here? Open or closed? The angle is open. So remember guys, congenital glaucoma always leads to what glaucoma? Open angle glaucoma. Due to maternal smoking or due to some autosomal recessive condition, what happens guys? Trabecular meshwork is not formed properly. Right? So remember guys, congenital glaucoma we are discussing. Risk factor is consanguineous marriage, as is an autosomal recessive condition. Second is maternal smoking. Both things leads to what? Both leads to hampering of the formation of trabecular meshwork. Hampering the formation of trabecular meshwork. Both the things can lead to hamper the formation of trabecular meshwork. If trabecular meshwork is not formed properly, you guys know the flow of aqueous humor will be hampered. That leads to accumulation of aqueous or increase in the intraocular pressure that leads to glaucoma. Now guys, if the intraocular pressure of a small child, guys, I'm talking about congenital, right? The intraocular pressure increases in the small child. What will happen? The pressure increases, the eyeball also increases. The eyeball diameter increases, the cornea expands, megalocornea happens. And remember guys, the eye looks like a bull's-like eye about to burst. That bull's-like eye formation is called as what? Buff thalamus. That is called as what guys? Buff thalamus. Buff thalamus is a classical feature of what glaucoma? Congenital glaucoma. You can see in this child suffering with what guys? Buff thalamus. Apart from buff thalamus, what are the other things that the patient will have? The patient will have blepharospasm. Spasm of the eyelids is called as blepharospasm. The patient will have lacrimation. Blepharospasm, lacrimation, photophobia. These are the other features of congenital glaucoma. Right? The features of congenital glaucoma is what guys? You will see lacrimation. You will see blepharospasm. Lacrimation is seen, blepharospasm is seen. The eyeball becomes large. That is called as what guys? Buff thalamus. You will see buff thalamus. Right? Lacrimation, blepharospasm, buff thalamus. Right? The cornea, there is corneal enlargement. And as the cornea and the eyeball is getting enlarged, you will see some vertical scars developing on the cornea, which is getting about to rupture. That vertical scars is called as Harp's striae. That is called as what striae guys? Harp's striae. So remember guys, in congenital glaucoma, the hallmark feature is what? Buff thalamus. With buff thalamus, you will see lacrimation, blepharospasm. You will also see photophobia. You will also see what? Photophobia. These are the features of what glaucoma? Congenital glaucoma. Right? Lacrimation, blepharospasm, photophobia, classical triad of congenital glaucoma. Now guys, any person and presence of what striae? Harp's striae. Vertical scars developing on the cornea is called as Harp's striae. Now any person who is coming with congenital glaucoma, how will you treat? Remember guys, congenital glaucoma, why is the intraocular pressure raised? Why? Because beneath the angle is the trabecular meshwork which is not formed properly. So what you need to do guys? You need to repair the trabecular meshwork. The repair of the trabecular meshwork can be done through the angle which is called as goniotomy, or directly on the trabecular meshwork which is called as trabeculoplasty. But remember guys, When do you go for goniotomy and when do you go for trabeculoplasty? Remember, if at all the cornea is clear, if the cornea is clear, you are able to see the angle, then you go for the goniotomy. If cornea is not clear, remember this patient will be having a hazy cornea. One more feature is the patient will be having hazy cornea. Hazy cornea, right? So remember guys, how will you treat any person who is having this congenital glaucoma? What is the management given, guys? The trabecular meshwork is not formed properly. What we need to do, we need to repair the trabecular meshwork either by goniotomy or either by trabeculoplasty. The choice of surgery totally depends on what, guys? It totally depends on the presentation. Okay? Goniotomy is safer and better, but due to the fact that cornea is hazy, we can't see the angle. Hence, we go for trabeculoplasty or trabeculectomy. Okay? Sometimes we go for trabeculectomy, right? So, we'll repeat from here. The surgery that could be done over here is either goniotomy or either trabeculectomy. Okay. Now, goniotomy is done when the cornea is clear. When you are able to see the angle, then you go for goniotomy. You take an incision in the angle and you repair the trabecular meshwork. You open the meshwork. But if the cornea is not clear, directly you go for trabeculotomy. You give incision in the trabecular meshwork, or either you can go for trabeculectomy, removal of the trabecular meshwork. Okay. So, remember guys, the surgeries which are done are goniotomy and trabeculectomy. Okay. If the cornea is clear, you go for goniotomy. If the cornea is not clear, you go for the trabeculectomy. But you should remember, guys, you should remember this. In congenital glaucoma, the problem is in the trabecular meshwork. If anyone asks you congenital glaucoma patients will have open angle or angle closure, what's your answer? Remember, open angle. Why open angle? Open angle means what? Open angle glaucoma means what? The angle is open. The pathology is beneath the angle. Open angle means what? Angle is open and the pathology is beneath the angle, which is mostly the trabecular meshwork only. Okay. So that was regarding what glaucoma? That was regarding the congenital glaucoma. Now coming to adult glaucoma. In adult glaucoma, we are again dividing the adult glaucoma into two types. What two types are we dividing, guys? We are dividing into open angle glaucoma and angle closure glaucoma. So, open angle glaucoma and angle closure glaucoma. When do you tell it as open angle? When the angle is open. The problem is basically the pathology is basically beneath the angle. Angle closure means something is compressed the angle and the angle is closed and the patient develops glaucoma. That is angle closure. So, OAG is open angle glaucoma and ACG is angle closure glaucoma. Angle closure glaucoma. Now guys, if I am asking you which is more common, okay? Which is more common? Remember, open angle is more common. If I am asking you which is more dangerous, what's your answer? Open angle or angle closure, which is more dangerous? Actually, angle closure produces severe pain, but still it's not dangerous. The most dangerous is what? Open angle. Why, sir? Why open angle is most dangerous? Is it producing that severe pain? No. Actually, open angle glaucoma never produces pain. It is a painless condition. Guys, if I tell you that there are two diseases, okay? Disease A and disease B. Disease A, when the patient has disease A, he is not having any symptoms. The disease is inside his body, he is not having symptoms, he is not aware of it. Disease B, he is having symptoms. When you have symptoms, you go to the hospital. The doctor looks at the symptoms and he manages you. Which is dangerous, guys? A or B? The disease with symptoms is dangerous. The disease without symptom is dangerous, or disease with symptoms? The disease without symptoms. An asymptomatic patient is always dangerous. Might be cancer. The patient might be having cancer inside his body. He is not at all aware of it. Okay? and he's not having any symptoms. By the time he's having symptoms, now he's like he had developed some symptom when he went for the scan. Now the doctor is telling that cancer has spread to almost all of the body. You are having a grade 4 cancer and all. Now the patient is about to die. So remember guys, open angle is dangerous or angle closure? Always open angle. Why? Why? Because it's a painless, not producing any symptoms. Angle closure is not that dangerous, but it is very painful condition. Okay? So when you don't have symptoms, you don't get treated also. When you have symptoms, you get treated. As there is treatment for symptomatic things, that's why the disease with symptoms, it is not that dangerous. So basically, open angle glaucoma is asymptomatic and it is very dangerous. So open angle glaucoma is very dangerous. Why? Because it does not produce any symptoms. By the time open angle glaucoma produces symptom, the only symptom that it will produce is what? It will, by the time it produces symptoms, basically it will be in an irreversible stage where you cannot reverse it back, right? So yani basically what we need to understand, what's the symptom? The patient will be left out with a tubular or tunnel shaped vision. Patient will be having what vision guys? Tubular or tunnel shaped vision. The other symptom of open angle glaucoma is what? The patient will be having frequent change of presbyopic glasses. Meaning what? Patient is suffering with presbyopia. You guys know what is presbyopia? Age-related hypermetropia is presbyopia. This patient will be coming at the age of 45 telling the doctor, I am not able to read the near things. You will give him +3 diopters glasses. After 1 month, again he is telling that with these glasses also I am not able to read. You give him +4 diopters glasses. After 1 month he is telling, initially I was able to see, but now with +4 also I am not able to see. And a frequent change in the presbyopic glasses is the second common symptom of open angle glaucoma. But again, by this time the disease will be in the irreversible stage. What is the basic pathology of open angle glaucoma? First of all, before going for a basic pathology, tell me the risk factors. Males, myopes, elderly males and myopes are at higher risk of developing open angle glaucoma. What is the basic pathology? If anyone asks you what is the basic pathology of open angle glaucoma, always remember open angle, the name is only saying angle is open. The problem is basically beneath the angle. Beneath the angle there is trabecular meshwork, Schlemm's canal, episcleral veins. 90% of the time the cause of open angle glaucoma is what guys? The trabecular meshwork fibrosis. Trabecular meshwork getting fibrosed. The most common pathology of open angle glaucoma is trabecular meshwork fibrosis. Trabecular meshwork fibrosis, right? So which is more dangerous guys, open angle or angle closure? Always open angle. Why? Why? Because it's an asymptomatic condition. By the time it produces symptom of tubular or tunnel shaped vision, the disease will be already in a irreversible state. Okay, the other symptom is what? Frequent change in the presbyopic glasses, right? So guys remember, open angle glaucoma is 3 times more common than angle closure glaucoma. But in India, the incidence is 1:1. Yani one case of open angle glaucoma, other case you will see angle closure. Yani the ratio is similar only. Okay. Now guys, remember, which is more dangerous? Which is more dangerous, open angle or angle closure? Which is more dangerous? Open angle glaucoma is more dangerous. Why open angle glaucoma is more dangerous? As it's an asymptomatic condition. As it's an asymptomatic open angle glaucoma is a more dangerous. Why? Because as it is an asymptomatic condition, right? So right there, risk factors for open angle glaucoma. It is elderly males and myopes are at higher risk of developing open angle glaucoma, right? Why it is more dangerous? Why? Because it's an asymptomatic. The only symptom of open angle glaucoma is what guys? Patient will be having tubular, patient will be having tubular or tunnel shaped vision. Tubular or tunnel shaped vision. Okay? Patient will be having tubular or tunnel shaped vision. Right? And by this stage, the disease will be already in an irreversible state. By this stage, the disease will already be in a irreversible state. Irreversible. Other symptom of open angle glaucoma is what? What is the other symptom of open angle glaucoma? Other symptom is frequent change in presbyopic glasses. Frequent change in presbyopic glasses. Frequent change in presbyopic glasses. That's the other symptom. Okay. Now, we have discussed the risk factors. We have discussed which is more dangerous and all. Right. So, now we will discuss the pathology. The pathology of open angle glaucoma. Come on guys, what is the pathology of open angle glaucoma? This is very, very important. The pathology of open angle glaucoma is what? It is the trabecular meshwork fibrosis. It is the trabecular meshwork fibrosis. Trabecular meshwork fibrosis. That is the most common pathology of open angle glaucoma. As the trabecular meshwork is fibrosed, the aqueous humor does not flow. As the aqueous humor is not flowing, what will happen? Aqueous gets accumulated inside the eye, that leads to the raised intraocular pressure. So, the basic pathology of open angle glaucoma is trabecular meshwork fibrosis. Trabecular meshwork fibrosis. That is the basic pathology of what glaucoma? Open angle glaucoma. Open angle glaucoma. Right. Now, coming to the next, which is called as angle closure glaucoma. Angle closure glaucoma. Now, before going to the angle closure glaucoma, what else we need to remember? 20 minutes is the time taken to adopt the dark, but sometimes in glaucoma it might be increased. In glaucoma it might be increased. So, remember guys, in open angle glaucoma there is basically, before going to the angle closure and all, in open angle glaucoma, I told you that the symptom of the patient, it develops at a very last stage. So, how will you manage the open angle glaucoma patient? How will you come to know this patient is having open angle glaucoma when he is asymptomatic? For that, what we need to do is, for every patient who is at risk of developing open angle glaucoma, we have to check their intraocular pressure. How will you check their intraocular pressure? Intraocular pressure is checked by tonometry. So, remember guys, for every patient who is at risk of developing, first of all, we need to discuss what is the patient who is at risk of developing open angle glaucoma. Patient having family history of glaucoma, right? Family history of glaucoma, elderly patients, male patients, myopes patients who are hypertensive, patients who are mustard oil intake. Mustard oil intake can lead to glaucoma, right? Family history we have discussed. Apart from that, diabetic patients are there, hypertension is there, hyperthyroidism patients are there, hypothyroidism patients are there. We are discussing about the risk factors. We need to discuss about the risk factors of glaucoma. Who are the patients who are at risk of glaucoma? Patients having family history of glaucoma. Patients, race is also very important guys. In Indians, you will see low tension glaucoma and all. Okay. So, family history is there, race is there. Okay, age is there. Elderly patients are at risk of glaucoma. Apart from that, some underlying disorders can lead to glaucoma such as hypertension, hypothyroidism, diabetes, myopes. These are all risk factors for developing what? Glaucoma. Apart from that, what else? What are the other risk factors for developing glaucoma guys? Mustard oil intake, myocillin gene. These are the risk factors for developing glaucoma. Any patients who are having these risk factors, we have to check their intraocular pressure every 3 months so that we can come to know whether he is having this glaucoma or not. Okay, so open angle glaucoma, what we need to do? We need to check the intraocular pressure every 3 months. Who are the patients who are at risk? Family history, age, race, right? Myopes, diabetic, hypertension, hypothyroid, mustard oil, myosin gene and alcohol. Patients who are alcoholic, they are also at risk of developing what? Open angle glaucoma. This was regarding the risk factors for developing what glaucoma, guys? Risk factors for developing open angle glaucoma. Risk factors for developing open angle glaucoma. Now next coming to what? Angle closure glaucoma. Angle closure or close angle glaucoma. What is meant by this close angle glaucoma? If you go with the name, you will come to know what is close angle glaucoma, guys. Close angle or angle closure means the angle is closed. Why is the angle closed? Come on, guys. Any reasons? We have discussed that in uveitis, I guess, no? Iridocyclitis. Any glaucoma developing due to uveitis is called a secondary glaucoma. But why the patient develops glaucoma in uveitis? If there are some nodules developing on the iris, it sticks to the lens called as posterior synechiae, that causes iris bombi, that compresses the angle, leads to what? Angle closure glaucoma. That is secondary. We are discussing angle closure. Angle closure glaucoma means what? Angle is closed. What is the pathology of angle closure glaucoma? It is the, remember guys, when we dilate our pupil, and basically you enter a movie theater, there is total darkness in the movie theater. Your pupils are dilated. You are trying to find your seat, your pupils are dilated. Suddenly there is flash of light in the theater, your pupils get constricted. When the pupil is dilated, pupil is the space between the upper iris and lower iris. When the pupil is dilated, it is 10 mm. When the pupil is constricted, it is 4 mm. But in some patients, such as elderly females are at risk of developing angle closure. Imagine an elderly female going into the movie theater. She is trying to find a seat. Suddenly, when she enters the movie theater, her pupil is dilated. Suddenly there is light being flashed in the theater, her pupil is now coming back to constriction. But while coming back to constriction, this elderly female pupil will be stuck in a mid-constricted phase. Mid-constricted or mid-dilated phase. Yani ki it is stuck at what position, guys? Remember, fully dilated is 10 mm, constricted is 4 mm. It is stuck at a mid-dilated phase, 6 mm. This mid-dilated pupil, what happens? Pupil is nothing but iris, space between the upper and lower iris. Due to this mid-dilatation, what happens to the iris? The iris becomes shaky and this iris goes and sticks to the lens. That is again posterior synechiae. In rest story, you guys can easily depict. If the iris attaches to the lens, what happens to the posterior chamber? Posterior chamber closes. If posterior chamber closes, what happens to the pressure? What happens to the pressure inside the posterior chamber? Increases. The pressure inside the posterior chamber increases much. That leads to bulging of the iris, which is called as iris bombi. That leads to what? Closed angle glaucoma. The angle gets compressed and closed. Leads to what, guys? Angle closure or closed angle glaucoma. So we are discussing about what? Angle closure glaucoma. Angle closure glaucoma. The basic pathology for angle closure. But before going to the basic pathology, first we need to understand who is at risk of developing angle closure glaucoma. Right? So the risk factors for angle closure glaucoma are what, guys? I told you what? Elderly women, right? Elderly women who is hypermetropic. Elderly woman who is hypermetropic. Why? Because usually elderly women, they are having a shallow anterior chamber. Elderly women will have shallow anterior chamber. Okay? So anyways, guys, so elderly woman who is hypermetropic, she is at higher risk of developing what glaucoma? Angle closure glaucoma. Angle closure glaucoma. The basic pathology of angle closure glaucoma is what, guys? The pupillary block, the mid-dilated pupil. It occurs when the pupil dilate halfway, mid-dilated. Normally, when it is constricted, it is 4 mm. Full dilatation 10 mm. Half dilatation is 6 mm. Due to the half dilatation, what happens? The pupil is half or mid dilated, the iris becomes floppy like and gets attached to the lens. The pressure inside the posterior chamber increases, which pushes the iris forward and the angle is close. Which pushes the iris forward and the angle is close. This pushing of the iris forward is called as what? Iris bombing. It is called as iris bombing. Okay? If this is occurring due to some nodules, that is due to uveitis. Uveitis यानी कि secondary glaucoma. But we are talking about normally without uveitis also, patient will develop an angle closure. But the cause of pathology is what? Pathology is the pupil only, the mid-dilated pupil. Whether it is uveitis or here, it is the pupil it is the iris that is causing glaucoma. Okay. So, angle closure glaucoma, the basic pathology is what? It is the mid-dilated pupil. Mid-dilated pupil. So, guys, what is the clinical feature of a patient who is suffering with angle closure glaucoma? What is the clinical feature? Patient will have sudden onset of pain which is very acute. Sudden severe pain in the eye which is very acute. Guys, remember, if you want to choose ophthalmology as your PG subject, you can easily choose it. Why? Because you don't have any emergencies in Ophthalmology is the thing which is without emergencies and all. But remember, guys, in ophthalmology, the only emergency is angle closure glaucoma or any chemical injuries of the eye. Okay? So remember, look over here, guys. Angle closure glaucoma, the patient will be having severe pain, acute pain, tremendous pain. Hence, it is called as what? Acute angle closure glaucoma. The patient feels tremendous pain and starts to have some vomiting also. Right? So, angle closure glaucoma is most likely to occur in the evening. Why? Why not in the daytime? Why? Because in the daytime, everywhere you are surrounded by lights and all. When you are surrounded by lights, everywhere you are having what? Your pupil is what? Always constricted only. In the night time, outside it is dark. In your home, you are having lights. Imagine, guys, outside it is dark and in your home, you are having lights. So, when you are sitting in your home, an elderly female who is sitting in her home, her pupil is constricted. And suddenly she goes outside and it will be dark. So, what happens to the pupil? Pupil gets dilated. While coming from constriction to dilation or from dilation to constriction, the pupil can stuck into the mid-dilated phase that can stick to the lens that can cause angle closure glaucoma. So, angle closure glaucoma is most likely to occur in the evening or the night time, 7 p.m. or 8 p.m. Example, I gave you the example of a movie theatre. Pain in the movie theatre, it could be angle closure glaucoma. How will you come to know what are the signs of angle closure glaucoma? What are the signs that you see in the patient's eye and you can say that this is angle closure glaucoma? The cornea, remember the guys, the eye becomes stony hard. The cornea becomes flat. Anterior chamber becomes flat. The cornea becomes steamy. Once again, guys, we had just cut it. Start from here. What are the signs of angle closure glaucoma? The signs of angle closure glaucoma is what, guys? The eye becomes stony hard. The anterior chamber is flat. There is a steamy cornea. The cornea becomes steamy, right? And how's the pupil? The pupil is always mid-dilated, right? These are the signs of angle closure glaucoma. Other clinical features that you can see in angle closure glaucoma is what? The patient will also have colored halos. Come on, guys. What is meant by colored halos? Colored halos means what? Surrounding a source of light, surrounding a source of bright light, you will see some scattering of colors. Guys, you can experiment it. All are having smartphones, right? Take some oily hand, right? Rub that oily hand to the camera, back camera of your phone, right? Take a picture, then take a picture of some bright source of light. When you take a picture, what you will see? You will see that bright source of light is coming, but with that some vibrant colors, some rainbow-like colors are scattering. That is called as colored halos. Is colored halos only the feature of glaucoma? No, sir. Colored halos can also be seen in what condition? It can also be seen in cataract. It can also be seen in mucopurulent conjunctivitis. Then how will you come to know it is the colored halos of cataract or conjunctivitis? Again, first we need to check the intraocular pressure. In cataract, intraocular pressure is normal and all. But still, if you want to differentiate the colored halos of cataract with glaucoma, you can go for a test which is called as Fincham's test. Fincham's test, we use a synopic slit. We use a disc-like thing. We keep that disc, basically there will be a bright source of light. We keep a disc over here in front of the eye, and that disc will be having a hole. We tell the patient to look inside the hole. Okay? If he sees colored halos, which are splitting, if we see colored halos which are splitting, if he's seeing colored halos which are splitting into many colors and all, then it is a case of cataract. It's a case of cataract. But while spinning, if he's seeing just colored halos surrounding the source of light only, which are not splitting, then it is a feature. Then it is a feature of glaucoma. So remember guys, colored halos are seen in many conditions. Cataract, glaucoma and mucopurulent conjunctivitis. How will you differentiate the colored halos of cataract with glaucoma? This is very important. With a test called as Fincham's test. After doing Fincham's test or while doing Fincham's test, if the patient is telling there is splitting of colored halos, then it is cataract. If there is no splitting, then it is a case of glaucoma. Right? So colored halos are the feature of glaucoma. What are colored halos, guys? What are colored halos? Surrounding a bright source of light. What are colored halos? Colored halos are colored halos are that, or colored halos are colored circles, not bright circles. Colored halos are colored circles that surrounds a bright source of light, surrounds the bright source of light. So there are many features of angle closure, guys. Patient is having severe pain, vomiting, patient is having colored halos, eye is stony hard, cornea is steamy. These are many symptoms and signs of angle closure glaucoma. One of the features is colored halos, right? Colored halos are colored lights which are colored circles of light that surrounds a bright source of light. That is called as colored halos. But again guys, colored halos, is it seen in glaucoma? No. Colored halos is seen in many conditions. Colored halos can be seen in, they can be seen in cataract, they can be seen in cataract, they can be seen in mucopurulent conjunctivitis. And they can be seen in glaucoma. How will you differentiate the colored halos of glaucoma with cataract? We go for a test which is called as Fincham's test. We go for a test which is called as what test, guys? Fincham's test is done to differentiate the colored halos of cataract and glaucoma. Here we use a synopic slit and rotate in front of the eyes. If the colored halos split, it is a case of cataract. If they don't split, it is a case of glaucoma. It is a case of glaucoma. This is regarding what, guys? This is regarding the glaucoma. Is it clear, guys? This is regarding the glaucoma. Okay. So guys, when you compare the glaucoma, the open angle with angle closure glaucoma, as I already told you, which is more dangerous, guys? Open angle is more dangerous than angle closure. Why open angle is more dangerous than angle closure? Why? Because open angle glaucoma doesn't produce any symptoms, whereas in angle closure glaucoma, the patient is having pain and all. Okay. So when you compare open angle with angle closure glaucoma, remember who is at risk of developing open angle glaucoma? Males, myopes. And what is the symptom of the patient, guys? What is the symptom of the patient? Is the patient having a painful loss of vision? No pain. The patient will be having loss of vision in the later stages where he is left out with the tubular or tunnel shaped vision. So we are just comparing. So males, myopes, low painless loss of vision, but there is no corneal edema, there is no colored halo seen. Whereas in angle closure glaucoma, the risk factors are elderly female, hypermetropic, and patient will be having painful loss of vision with corneal edema and colored halos. Now, so I told you guys which is more dangerous, angle, right? So I told you guys which is more dangerous, open angle or angle closure. Open angle glaucoma is more dangerous. Okay. So guys, whenever you are suspecting glaucoma, what will you do? First of all, guys, if open angle is more dangerous, why is open angle dangerous? It is asymptomatic. When it is asymptomatic, how will you come to know that the patient is having this glaucoma and all? If that question goes to me, that remember, glaucoma is a condition that can also that can lead to blindness if not treated in time. I told you there is open angle and angle closure. Open angle is more dangerous. Why? Because asymptomatic. So how will you know that this patient is suffering with open angle glaucoma? You have to look for the risk factors. What risk factors, guys? Open angle glaucoma, young males and myopes, males and myopes are at risk of developing open angle glaucoma. Males and myopes are at risk of developing what? It's not young males, it is elderly males developing open angle glaucoma. So any elderly male after the age of 45 or after the age of 50, you have to check their intraocular pressure regularly. Then only you will come to know. Okay. So there are some provocative tests that can detect glaucoma. Whether this test can be done for open angle as well as angle closure glaucoma. The provocative tests that can be done for detecting glaucoma are what, guys? First test is called as what? Water drinking test. Second test is called as what? First test is called as water drinking test. Second test is called as what? Prone test. Okay? Prone test. So what are the tests which are done for detecting the glaucomas, whether it is open angle or angle closure? For open angle or angle closure glaucoma, we can also go for some provocative test. Provocative test meaning what? You provoke the intraocular pressure, you try to increase the intraocular pressure and then see how much of it increased. So remember, guys, the provocative test that could be done for glaucoma is what, guys? Dark room test, prone test, combined test, water drinking test, mydriatic and meotic test. Dark room test meaning what? I'll give you a brief review of what is dark room test. What you do is, a patient comes to your clinic, you check his intraocular pressure. His intraocular pressure will be coming like 18 mm of Hg. 18 mm of Hg. Then you send this patient into a dark room for 1 hour, and after 1 hour again check his intraocular pressure. Normally, if I go to the dark room, and before going to the dark room my intraocular pressure is 18, if I go to the dark room, after coming from a dark room my intraocular pressure, it becomes 22. Okay? It becomes 22, it increases by 4 mm of Hg. But if any person is having a raised intraocular pressure more than 8 mm of Hg from the baseline, then it indicates that it is having glaucoma. Then he is having glaucoma. So remember, guys, before sending the patient into the room, his intraocular pressure was 18. After he is coming from the dark room, there is how much increase in the intraocular pressure? More than 8 mm of Hg. If it is more than 8 mm of Hg, it is suggestive of glaucoma. That is dark room test. Second is called as what, guys? Prone test. The safest test is the prone test. Prone test meaning what? You tell the patient to lie in a prone position. But before making the patient to lie in a prone position, you check his intraocular pressure. We take the baseline value as 18. In normal circumstances, if you make a person lie in a prone position and after 1 hour of proning, you check his intraocular pressure will be increased. It will be increased by 4 mm of Hg or 5 mm of Hg. But if the intraocular pressure increases more than 8 mm of Hg, then it is suggestive of glaucoma. So that is called as prone test. Third test is called as combined test. Combined test meaning what? You make the patient lie down in a dark room in a prone position and you check his intraocular pressure. But the combined test has not that much of value. Why? Because sometimes the patient sleeps and you cannot calculate the exact intraocular pressure. Okay? Next test is what? Water drinking test. Water drinking test meaning what? You give the patient 1 liter of water. You tell the patient to drink 1 liter of water in 15 to 20 minutes, and then after 1 hour, you check his intraocular pressure. As you give water to the patient, the intraocular pressure increases. Remember guys, in a normal person, the increase should be more than 4 mm. If it is more than 8 mm of Hg, then it is suggestive of glaucoma. So these are the tests which are commonly used. In this provocative test, the most commonly used provocative test for open angle glaucoma is water drinking test. It is water drinking test. The last test is mydriatic and meiotic. First we will write about this test, then we will go to the mydriatic and meiotic test. Starting with the what test guys? Dark room test. Dark room test meaning what? Just write there. We send the patient into dark room for 1 hour. Then we check the intraocular pressure. If the intraocular pressure is more than 8 mm of Hg, if the intraocular pressure increases more than 8 mm of Hg from the baseline, then it is suggestive of glaucoma. That is dark room test. Next is prone test. Prone test यानी कि we keep the patient in prone position for 1 hour and then we check the intraocular pressure. If the intraocular pressure is more than 8 mm of Hg from the baseline, then it is suggestive of glaucoma. Combined test यानी कि sending the patient into a dark room and keeping the patient in a prone position. Sending patient into dark room plus keeping the patient in prone position. Keeping the patient in what position guys? Prone position. Combined test is not that much useful guys. Why? Because the patient sleeps in the combined test. The next test is called as water drinking test. Regarding water drinking test, what we need to remember? Water drinking test, where it is, right. Water drinking test meaning what? We give, in water drinking test, we give 1 liter of water in 15 to 20 minutes and after 1 hour we check the intraocular pressure. If the intraocular pressure increases by more than 8 mm of Hg after drinking 1 liter of water, if the intraocular pressure increases by more than 8 mm of Hg, then it is suggestive of glaucoma. Okay? Last test is what? Mydriatic meiotic test. Mydriatic meiotic test is the best test for best provocative test, but it should never be done for angle closure glaucoma, right? Mydriatic meiotic test meaning what? You keep a mydriatic drop that dilates the pupil. Second, you go for a meiotic which constricts the pupil. Never go for a mydriatic meiotic test in a person who is at risk of developing angle closure glaucoma. Who is the person who is at risk of developing angle closure glaucoma? An elderly female is at risk of developing angle closure glaucoma. Never do a mydriatic meiotic test. Never dilate the pupil of an elderly female. If you dilate the pupil, what will happen? The pupil gets dilated, there is no problem. But when she is back to her home, the pupil which was dilated, it might come back to its normal position. While coming back to its normal position, it might be stuck in a mid-dilated phase. And due to mid-dilatation of the pupil, what can happen, guys? Pupil is the space between the upper iris and the lower iris. What will happen? That iris can stick to the cornea or the lens, leading to what? Angle closure glaucoma. Angle closure glaucoma. So guys, what are we discussing? We are discussing about the mydriatic meiotic test. We are discussing about what? Mydriatic meiotic test. Right. So we are discussing about mydriatic meiotic test. Right there. It is the best test, but never to be done in patients who's at risk of, at risk of angle closure glaucoma. Who's at risk of what? Angle closure glaucoma. यानी कि basically elderly female. So never dilate the pupil of elderly female. If you dilate the pupil of elderly female, what will happen? What will happen, guys, if you dilate the pupil of elderly female? While the pupil comes back to its normal position, it might be stuck in mid-dilated phase. It might be stuck in mid-dilated phase, leading to what glaucoma? Leading to angle closure glaucoma. And if you go for a test, mydriatic meiotic test in this elderly female, she will be at risk of developing what? Angle closure glaucoma. So these are the tests, guys. These are the provocative tests which are done for what? Which are done for detecting glaucoma. Okay, it's already written. Never dilate elderly female pupil who is suspect to have an angle closure glaucoma. Right? So if you want to do this test, first take a gonioscope and look for the angle. Gonioscopy is the instrumentation that is required to view the angle. If the angle is open, you can go for this test. Okay, if the angle is closed, never go for mydriatic meiotic test. So now guys, remember, we have discussed regarding the intraocular pressure. In glaucoma, I told you glaucoma is characterized by three things. It is characterized by raised intraocular pressure plus optic disc damage plus visual field defects. Visual field defects.